Up. Hi, my name is Josie. This is my model Allison, and ideally, I would like to look at the thoracic, the lumbar, the SI joint, the hip, and specifically the core. All of these things are connected to where his pain is, and so I would want to assess all parts of those areas to make sure everything is moving properly and being activated correctly. But specifically, what I would really like to look at is her core strength, as that is essential for lifting heavy objects with the job that this case patient has. I would like to look at the hip mobility and strength to make sure we have the strength to be able to go down to these heavy squats and come back up while keeping our core engaged as well. And then I would also like to just look at what is being fired first, hamstring, glute, or back extensors, to know just what we're starting with and how we can address these deficits in the future. Okay, so Allison, there's a lot of areas I want to look at, but I'm just going to look at your core and your hips and your strength in your hips today. All of these are super essential. The core, if we have weak core, we're going to be all that pressure our core is not going to take is going to go right into our back, especially when we're lifting heavy objects. So keeping that nice and tight and nice and strong is really essential. So I'm going to look at that to see where we're at baseline and how we can improve. And then I just want to look at your hip range of motion, how much motion we have, especially when we're squatting. Do we have enough motion to go down and come back up? And if there's any deficits there, how to address that, as well as glute strength, making sure we have the strength to get up. Okay? Go ahead and lay on your back. I'm not going to do the straight leg raise test for the core. I'm just going to do a kind of a sit-up test, as he might be flared up in this irritable stage and his nerve pain. I'm just going to avoid that. So Allison, you can put your hands behind your head here. Okay, now I want you to just try and sit up for me. Okay, so I'm not seeing her clear with her scapulas. Okay, cross your arms, cross your chest, and sit up for me. Still struggling to get up. Put your arms by your side. Go ahead and try and sit up. I can see and feel that her inferior ankle of her scapula is clearing, so that is a grade 3. So we have a little bit of a weak core that we can work on, okay? All right, I'm just going to go through your hip right here and just see how we're moving. How does that feel?
Fine.
Okay. I'm just going to look at your external rotation. Looks good. How does that feel?
Good.
Going to come external, internal. A little tight.
Yeah, I can feel that.
Yeah. So that's something that we can work on. And here I could go into further assessment and put a belt on and do a lateral glide at the hip right here. All right, can you roll onto your side, please? I'm just going to check hip abduction. So straighten this out, hips forward. We're going to lift up as far as you can. Good. Can you hold it here? And then I'm going to apply a force. Slowly grade it. So a little bit of weakness here. You feel that how it gives? Yep. Something we can address. Go ahead and flip onto your belly. Ideally, I would look at both the left and the right to compare, but for time's sake for the video, I'm just looking at the left. First things first, I just want to see activation. Are we activating the back extensors, the glutes, or the hamstrings first? So I like to put my hand here on the back extensors, one on the glute and one on the back of the thigh. Are you okay with me here?
Yep.
Okay. Now I want you to just lift your left leg up. So I feel immediately hammies, back, then glute. And we want the glute to be fired first. Okay, Allison? So we're compensating a little bit. Our glute's not activating, so we're putting our hammies are doing our glute work, and then our back extensors are doing work it doesn't need to be doing. Okay, so just trying to calm the back extensors out and activate those glutes will be essential. Okay. All right, so let's test your glute mobility or hip extension here. How does that feel?
A little pressure on the back.
Okay. Yep. All right, and then I want you to bend your knee, lift up, just off the table a little bit, and I want you to hold it here. Don't let me push you down. Hold, hold, hold. Good. Awesome. How are you feeling?
Good.